everyone. My name is Vivian. So, my policy is going to be about prescription drug abuse, topic very important to my future career. So when I was researching, I saw a lot of stories. They involved people relapsing, and then many family members were deceased because of it. But one story stuck out to me. The first opening line for this story was found on the Medicine Abuse Project. It started with, "I would much rather be talking to my son than talking about him." No one ever wants that. I wouldn't want to be talking about a friend or a family member. I would rather be talking to them as well. So this story revolves about a young boy named Ken. He started his drug abuse problem in his sophomore year of high school, and like any parent, his parents saw his recent behavior, like he was going out too much, coming home really late. So, as any parent would, his dad drug tested him. The results came back, and they found that he was actually abusing prescription drugs. Not wanting to become an addict, Ken decided to sober up, and he pleaded to his father to start off at a new school. So his last 2 years, the junior and senior, it would be a fresh start. He was sober for those 2 years until he moved out for college, and at age 18, Ken was finally about to finish his freshman year of college with good grades and a wonderful job. However, it all came crashing down on a Monday in September in 2003, when his father found out that his son passed away due to an accidental overdose. The story behind this is that Ken and his 2 roommates were crushing out pills of OxyContin, and after that they were washing it down with some beer. He began to feel sleepy, so he decided to tell his roommates that he was going to, go to sleep for the night. Little did he know, the drugs slowed down his respiratory system to the point where it completely stopped, and his roommates found him dead the next morning. This situation is not uncommon in our society. Many people lack the proper knowledge about the serious consequences when abusing prescription drugs. But this is not the sole reason for the increase in deaths due to this problem. In order to properly address this issue, we must look at the picture as a whole. I propose that we establish a national plan that not only educates the public about prescription drug abuse, but also creates a monitoring program. So tonight, I will be presenting why this problem is such a big issue in our society. I will provide my explanation for my national plan, how it will help combat this increasing problem, and show the benefits and costs of it. So, how big is this problem? Well, the Substance Abuse and Mental Health Services Administration reported that in 2012, the amount of individuals abusing prescription medications has risen to about 7 million users. This is a 10% increase compared to the statistic in 2011. Additionally, the organization Trust for America's Health reported that the leading death in 29 United States in 2013 was due to prescription drug abuse. This number was greater than motor vehicle accidents and has doubled in 29 states since 1999. So now you're probably thinking, what is really the cause of the problem? Well, according to the FDA, prescription drugs are often the preferred choice of abuse because it has been mistakenly believed that prescription drugs provide a safe high since they are prescribed by doctors. This statement has been proven from data from PATS, as they found out that 1 in 6 parents believe that prescription drugs do actually give a safer high than street drugs such as heroin, cocaine, or marijuana. And with more than a quarter of teens, they also believe this as well. But what's so alarming is that it was reported that only 14% of these teens stated that they have discussed the consequences with the parents, when you compare to the 81% that have discussed the risks with street drugs. So the large difference between that, it clearly shows that we lack an education on how serious these consequences really are. However, like I said, we shouldn't point the blame only on the lack of education. We also should trace it to the root of the problem. Where are we getting these medications? The CDC reports that 20% of prescribers prescribe 80% of all prescription painkillers. In addition to that, People are obtaining multiple controlled substances because they're being prescribed these drugs from multiple providers. What this means is basically, say if I were to go to a doctor, my regular physician, and I had an ailment that requires like a narcotic or any controlled substance to help it. And then I could go to another specialist, tell them the same problems, I would get another prescription. I could go to my preferred pharmacy, fill it with the same insurance that I would normally, and then if I wanted to abuse that medication or any other class in that medication, I could go to a separate pharmacy that has no indication of what drugs I'm taking, no insurance, and the fact that these drugs these days, literally they cost like less than $100 for maybe 20 to 30 pills. So the cost is relatively inexpensive for people to pay out of pocket, and then they can use them. So how do we effectively combat this problem? Well, we need to decide that a national plan, because it is something that a lot of people don't really understand. So by using a national plan, we'll be able to aim to educate as well as monitor prescription drug abuse. Why we need to do this is because, according to the CLAD, in 2013, it was reported that only 16% of Americans believed that the United States was striving to reduce the prescription drug abuse problem. So if we are able to make a plan like this, it clearly shows that we're making more effort than we currently are. So how would we educate these individuals? Well, I suggest that the current government departments that we have now, such like the FDA, DEA, should pair up with pharmaceutical organizations. Additionally, we must seek these pharmaceutical organizations to help develop concepts for these educational programs. And already, many of our school programs, starting from 5th grade to even high school, already have drug abuse problem, programs that help advise you on drug abuse. But moreover, they always talk about street drugs. They don't talk about prescription drugs. I remember in high school and middle school and 5th grade, I never knew about prescription drugs. It was always marijuana is bad, don't take crack for anybody, meth and all that stuff. So in order to combat it, we need to make sure that we're providing the right amount of information on all subjects of the problem. Not only that, prescribers need to be mandated to enroll in courses that provide them information on disposal and storage, and also drug safety. Just because they're doctors doesn't necessarily mean they always remember every single detail about the information. So by incorporating it into their continuing education credits, this will help not only educate them, but in effect allow other patients also know what they're talking about. Like I said, education is important, but also drug monitoring. As an individual working at the pharmacy, I feel like this is a very crucial part in our system. The government will help fund these programs. They're programs that will create state-run electronic databases that will track prescribing and dispensing controlled substance to patients. So what this really means is that all the information about a controlled substance will be accessible for any provider or any pharmacist. No matter where you go, you'll be able to understand what this patient is taking, where it has been getting it from. So by creating this national plan, I hope that this will significantly reduce the prescription drug abuse problem. But we already know that this program will work because currently 16 states require healthcare providers to utilize this kind of program. It was found that from a research from the Office of National Drug Control Policy in 2010, that 41% of cases had prescribing change after the clinician reviewed the PDMP data, and almost 61% of patients were being prescribed few or no opioid medications. In addition, we also see groups such as PHRMA, which is an organization of the pharmaceutical research and biopharmaceutical companies, and they have partnered up with government departments such as the Department of Wildlife or the DEA to help dispose of medication and also promote national medication disposals. In addition to that, they have also collaborated with DARE. I'm sure everybody knows what DARE is, and law enforcement officials to create a curriculum that will help educate those about prescription drug prevention and also over-the-counter drugs. So efforts such as these are extremely daring, but at times come with different costs. So will this plan's benefits outweigh its costs? Well, the cost of educating the public should be relatively low, because I'm not suggesting to create a whole new government section for solely this purpose. I'm just simply stating that this plan should enforce existing federal programs such as the CDC, FDA, DEA, to work with other healthcare organizations such as local community pharmacies, board of pharmacies, and also board of medicines to help spread any educational information. And of course, there will be costs with this, but mainly not having to make a new sector for it will save a lot of money. The main cost for this will actually be funneling the federal money to implement the PDMPs, because we all know technology is very expensive. The amount of money it takes to maintain these systems can go up to almost $50 million to $100 million a year. However, incorporating PDMPs will allow healthcare providers to be trained and be able to use these tools for the better. A study from the Brandeis University found that states with this system have begun to see reduced doctor shopping, and a lot of diversion has also significantly reduced. So tonight, I hope that I brought your attention about the societal problem that we've all put in the back of our pockets. The problem of prescription drug abuse has exponentially increased in the past decade due to the lack of education and the excessive doctor shopping. To combat this situation, I have presented you with a necessary but effective proposal that will reduce the amount of prescription drug abusers in America. With that being said, the NADA reported that an average of 2,000 teens are misusing prescription drugs in the United States today, and the relapse rates have risen to about 40 to 60%. So it's very important that we start doing something now